He's a nice boy.
Just wanted to talk a little bit about FLUTD. It stands for feline lower urinary tract disease. That's FLUTD, feline lower urinary tract disease. And this is when we have obstruction of the urinary system. It tends to be most of a problem in male cats. It is natural for everybody to excrete certain things in the urine, like minerals such as magnesium and calcium. That is a natural process. But sometimes what happens is that instead of staying dissolved in the urine, those minerals start to come out of solution and start sticking together. They stick together more and more until they actually form little crystals. Sometimes you can see them with the naked eye. They look like little grains of sand. And you can imagine if you have that in your bladder, it's quite irritating. You end up with some blood and some mucus, and then when he tries to actually urinate it out, that can actually cause a plug in the urethra. Not such a problem for female cats because they have a short, wide urethra, but the males have a long, narrow urethra. So sometimes you end up with an actual obstruction, and then if you can't urinate, that is a life-threatening condition. So if you notice that your male cat starts having urinary difficulties in and out of the litter box several times within a very short space of time, if you notice that he's squatting and actually passing a little bit of bloody urine, if he's licking a lot back there, seems uncomfortable, you're going to want to have him seen by your veterinarian right away, or have him seen on emergency right away, because that is something that cats can die from. And what we do is we use an anesthetic and we go ahead and unblock the urethra. They usually then have a urinary catheter in place for a couple of days, and then we check and make sure that the kidney function is good, because having that urinary blockage is not good for the kidneys. Some of these cats will do well on a prescription diet. There is also some thinking that adding water to the diet, like for instance providing canned food as well as dry food, may be helpful. We don't really know exactly what causes it. But the thing to watch for is a cat that looks like he's having difficulty urinating, or in and out of the litter box doing a lot of licking, or if it looks like he's squatting and not producing anything, you're going to want to have him seen right away.